person to person. So droplet nuclei and aerosols, this is kind of a big deal when it refers to the masking issue that we have had in the US. So early on, basically, most people, and I would include myself in that, with the pandemic of COVID-19, the virus and viruses in general, they're very, very small. So they can get through stuff. They can get through little tiny pieces. And so trying to put a cloth over your mouth is really not going to stop them. However, they are carried in droplets, and droplets are stopped by masking. And especially in 95s, but I'm just saying in general, droplet nuclei can be stopped by masking. So what is the difference? An aerosol cannot be stopped by masking. And so the flu is carried on an aerosol and aerosolized particles. And so we wouldn't mask up for the flu, but we would mask up for COVID-19. And this is what we've learned since. So early on, we didn't really know how it was transmitted. There's a lot of things we didn't know. So we had to wait until the data was in. And when the data came in, it's been transmitted by droplet nuclei. So it is something that can be stopped by masking. So what is a droplet nuclei? It is dried microscopic residues created when microscopic pellets of mucus and saliva are ejected from the mouth and the nose. They're very large goobers, basically, that you're sneezing out into the air, and they're usually something you can actually see. Aerosolized suspensions, they're smaller. They are suspensions of fine dust or moisture particles in the air that can contain live pathogens. And so this is a little different. Microscopic residue versus droplets that you can maybe even see. And so this is why it's been a big deal. And part of the reason is science, you know. We know what we know now, and sometimes we'll find out later that we were wrong. And that is really hard for a lot of people to accept. And so a lot of people are starting to not believe in science because we change our minds. We change our minds based on actual data, though. So that's all I'm going to say about that. And we're going to move on into hospital-acquired infections. So healthcare-acquired infections, HAIs there's quite a few of them. And some of the things that we were most concerned about, such as MRSA and C. diff infections, you don't hear about those as much anymore. And a lot of this is because people are really doing what they're supposed to do with universal precautions, and our testing is getting a lot faster. There are still some other catheter-associated UTIs are on the rise, as according to, well, 2008 to 2013. I don't know what it is beyond that, but we do see some things like that as increasing, but these other rates decreasing. So there are actually epidemiologists, hospital epidemiologists that do what they can. They find a trend of lots of people getting infections from this one particular doctor, and then they'll follow them around and see what all that they're doing wrong and try to correct their incorrect procedures. So medical asepsis is the things that they need to do to practices that they need to lower the microbial load in patients and caregivers in the hospital environment. Surgical asepsis is what they do in surgery, making sure that everything is under sterile conditions. And so those two levels are a little different, but medical asepsis in general, like wearing a mask when you go into the hospital, that's an example of medical asepsis. Using hand sanitizer before you go in to a patient's room, that is another example. So infection control officers, they track outbreaks, they identify the breaches, and then they train the healthcare workers in aseptic technique. So Koch's postulates were used. They were developed in the 1800s to determine the causative agent. The etiologic is the causative agent of the disease. So what organism is causing the disease? Sometimes, again, we said it's multiple things. It's not always one thing or another. It may be multiple microbes. But his postulates were a series of proofs that gave us a scientific method and way to identify the causative agent of disease, which was a really major kind of event in the history of microbiology. So basically, they take evidence of a particular microbe is found in every case of the disease. They isolate it and do some biochemical tests and other characterization of the microbe. Then they give that microbe to another healthy lab animal, a healthy subject, and if it gets that disease and you isolate it and you have the same biochemical results, then you know you have identified the causative agent of the disease. So epidemiology is the study of disease in a population. It's looking at the frequency and the distribution of the disease, and there are notifiable or reportable diseases. And by law, the diseases must be reported to authorities. Others are a voluntary thing. So the different states will have county boards of health, and then in Louisiana, they would call it a parish board of health, and all of them report to the counties, and the parishes boards of health report to the state, and the state reports to the Centers for Disease Control. So the Centers for Disease Control and Prevention tracks not just infectious disease, but a lot of different diseases, but infectious disease for sure is one of their main things. And they are part of the U.S. Public Health Service. Most countries have some sort of public health service or Ministry of Health that does the same thing. And all of those, for here in the United States, the CDC publishes a weekly notice of diseases that we're seeing, and if it's noticed something that's of note, then they'll put it into this Morbidity and Mortality Weekly. They also will publish yearly different diseases and the surveillance and number of cases and incidents and all that, details and statistics about the disease from the previous year. So the CDC shares that information with the World Health Organization, and they are the ones, they're in Geneva, Switzerland, and they do worldwide tabulation and control and help to establish healthcare principles and practices in other countries and just support them. So epidemiological statistics. So here are a bunch of new terms, some new, some you probably know, but to differentiate between them so you understand the difference between them, I'm going to spend a little bit of time going through these terms. You should probably do some Kahoots or maybe the McGraw-Hill Connect, or make up some Quizlets for yourself or some flashcards for these because there's a lot of them. But prevalence is the total number of existing cases with respect to the entire population. And incidence measures the number of new cases over a certain time period. It's also called the morbidity rate. So how many people are, morbidity is talking about illness. So morbidity is talking about illness. Mortality is talking about death. Mortal, we are mortal beings, we die. And so it measures the number of deaths in a population due to a particular disease. So we do this, data is collected, and you do a lot of statistical analysis on things. They can graphically represent it by just a time, over years, and the number of cases. They can look at the number of people who have it and show a kind of a pie chart sort of thing over different areas of the country. So this is looking at HIV in the United States and the region of residence, and then this is showing geographically showing where in the world do we see malaria. So this is a malaria. Transmission is high, transmission occurs in some parts, and then we don't see transmission at all in the green areas. So epidemics are, there's about 4 terms that we're going to show you here, and you can look at the chart and kind of figure out what type it is by the chart. The point source epidemic has to do with everyone became infected from a single source at the same time and place. So like in a fundraiser event from this particular period of time, and then all these people got sick within the next few days, but they all got it at the same time and place. Common source means that it could be over a period of time, but a common exposure to a single source. So you have a single source, and everybody who came into contact with that source until they figured it out got sick. So this would be like the Legionnaires' Convention, and over a period of a couple of weeks, different people were exposed to it, but it was a single source. Single source compared to the point source where they get it at the same point in time and space. Propagated would be where you have an infectious agent and it's sustained, you have person to person. So this would be like COVID or SARS. This is actually the picture from SARS in 2003, the original SARS. And so it's a result that it's communicable from person to person. So you have ups and downs, and that's what we see with SARS as well. So it's sustained over time in a population, and because it is communicable. And then a pandemic is spread over across continents. So when it's on more than one continent, that's typically considered a pandemic. Some other epidemiological terms. An index case is the first patient found in an epidemiological investigation. So a cluster of cases, maybe. The first case in a cluster of cases. It's not like the first person who had HIV ever is the index case. No. We're talking about a cluster of cases and who was the person at the center of that. Who was the first patient in a cluster. So endemic is an infectious disease that exhibits a relatively steady frequency over a period of time in a particular geographic locale. So if it's like a normal numbers and that's sustained steady frequency over a long period of time, that's an endemic. So we're probably seeing endemic numbers of COVID at this time, but a good example would be Lyme disease in Connecticut, which is where it kind of is concentrated at, and it's just like endemic to that area. But it is not endemic to every part. It's like Tucson, Arizona would not necessarily have Lyme disease because it is particular. It's carried by a particular tick that is only in a certain environment and only located in a certain area or geographic location. So sporadic disease would be occasional cases, like we'll have hantavirus occasionally reported in irregular intervals at random locations, and so that is not like showing a trend or anything. It's just sporadic outbreaks or sporadic occurrences. So here you can see like Lyme disease is endemic in these areas in the northeastern United States, but like in the southwest you have maybe sporadic occurrences. And then you have these endemic and epidemic thresholds. So yeah, the epidemic threshold is the top line, and then you have the seasonal baseline. That would be like the endemic numbers. So global issues with the epidemiology, we have newly identified microbes, which we talked about this early on in Unit 1, the emerging infectious diseases. So like HIV, SARS, novel strains of influenza, SARS-CoV-2, and then we have the re-emerging diseases like dengue fever, tuberculosis, yellow fever. So those are becoming issues, and obviously SARS-CoV-2 has been a big issue worldwide, shut us down. So Section 13. So our concept check for Section 13.3, here are some questions related to the terminology in the epidemiology section. So make sure you review these, and these are good examples, but there are a lot of terms. So If you don't know a term, I would highly suggest that you make flashcards for the terms that you don't know or you kind of don't know. And then don't make flashcards over every term. Like if you know what epidemic is, don't make a flashcard over it. If you can answer these questions without any help, then you know it, and you don't really need to make any flashcards. So anyway, here's our first question. The number of new cases of disease over a certain time period is the blank. So I suggest you pause and then come back, and I'll go over the answer. So the number of new cases, the emphasis on new cases, that would be morbidity or incidence. Incidence is the actual term, and then morbidity is the more common name that we give to it. So morbidity, the number of people who are afflicted with a disease, number of new cases over a certain time period, that's incidence. So the blank rate is the number of deaths in a population caused by a particular disease. So that would be the mortality rate. So we're mortal beings, we die, so that's the rate of death. Question 3, an blank disease is seen at a steady rate over a long period of time in a particular location. So the term we're looking for here is endemic. Endemic is when you have a steady frequency in a particular location. So question 4, a blank is an epidemic occurring over multiple continents. So you should get this one. This one is pandemic. So it's an epidemic, but it's occurring over multiple continents. And at some point, the World Health Organization said, yes, this is a pandemic. We need to do something about this. And with SARS-CoV-2 and COVID-19. So question 5, blank diseases are caused by newly identified microbes. So the term here is emerging infectious diseases. Those are newly identified. And if it's been around and then it came back, it went away and then it came back, that's re-emerging. So newly identified, that would be like SARS-CoV-2 would be an example. So that is the end of chapter 13.